Glaucoma is a symptomatic disease. The only condition that is symptomatic type is acute angle closure glaucoma or acute congestive angle closure glaucoma. In this condition, the patient will present to the emergency department in a condition of painful impairment of vision. The patient yawing from pain, even the presentation could resemble the presentation of acute abdomen. Otherwise, the clinical presentation of patient with glaucoma is null. Usually, we accidentally discover the patient in the casualty during routine examination. We measure the intraocular pressure for the patient, or we send him for visual field examination and we found he had limitation and he have pathology. There is as any other disease, glaucoma have many risk factors. Could be hypertension, diabetes, rhinoid phenomena. The drug can be a risk factor, and when we have a glaucoma medication, we will explain to you how many drugs can affect the level of intraocular pressure. Treatment of glaucoma involve medical treatment and then involve laser treatment and also involve surgical treatment. In condition of medical treatment, how we start to choose the agent according to the patient clinical condition. We start with single agent and then measure intraocular pressure and then couple with another one or even triple treatment. Sometimes we shift to the laser trabeculoplasty. In this condition, we induce trauma inside the trabecular meshwork to increase the pore, so there will be increased drainage. And the last one, it's surgery. Again, we in condition of trabeculectomy, we stopping the trabecular meshwork and to provide or enlarging the drainage pathway toward the conjunctival blood vessels. Condition of primary angle closure glaucoma, as we said, is it a condition of acute congestive angle closure glaucoma where the patient will present with symptomatic condition and present with a red eye, treated in emergency department and the line of management in front of you. There is another specific type of secondary glaucoma. It is neovascular glaucoma. We faced it actually so many times. It is due to mainly diabetic retinopathy, but could be due to other condition that called vasculopathy. Neovascular glaucoma, here we see in this picture, there is rubiosis iridis, abnormal neovascularization in the iris. There will be creeping here. These blood vessels will be creeped toward the angle and then cause fibrosis and then will close the angle in zipper-like fashion. It starts at open angle glaucoma, then shift to closed angle glaucoma, and also the line of management is mentioned for you. Another type of glaucoma is a congenital one, developmental glaucoma. Developmental glaucoma, the child will present with a corneal haze, ophthalmos, which means a large globe, a break in descemet membrane, and again optic disc cupping, and it needs emergency surgery. Actually, there is some term will represent you in the starting of the lecture is CCT, which means central corneal thickness. In the examination of glaucoma, this here, pachymetry mean measurement of corneal thickness. Gonioscopy, as we mentioned, is examination of angle structure. Thank you for your listening. وإن شاء الله ترجع الأوضاع ونشوفكم على خير.